Hi, everyone. Happy Tuesday again. Thank you for joining me. For those of you who've not met me before, I'm Dr. Partha Nandi, and I'm talking about gut health today, and specifically about anxiety and gut health. To me, anxiety is a huge problem in our country. I was telling my wife Callie the other day that I had a patient who I'm a gastroenterologist, so I had a patient who had Crohn's disease, and her life was crippled with anxiety. Not only could she not function in her daily life, but her disease, right? Her Crohn's disease was out of control. She had abdominal pain, diarrhea, constipation, back and forth, and she had abdominal pain. It was terrible. And so anxiety is, we think about anxiety as this kind of thing and like a concept, but for a lot of people, this is crippling. And for some people, it's so crippling that they just cannot live their best life. They can't live any life at all. Anxiety can cripple you and make your life miserable. So today, I'd like to give you some solutions, not just talk about the problem, my patient who had the issues that she did, but what about some solutions? And what about some solutions that don't always involve taking another drug, right, with all of its side effects? So I'll talk about gut health and how gut health can affect anxiety. So people who are watching, thank you so much again. Let us know where you're watching from, and share it with all the folks that are in your community. We'd love to be able to give good information. Lots of crappy information gets out there. I'd love for you to get good information out there. But I want to talk about anxiety, what it is. I'd like to give you some ideas about some of the symptoms of for anxiety, right? And also, how is the gut related to anxiety? How can we even tie them together? Because it's not intuitive, right? We don't think, we don't think about anxiety and then think about gut. How are they related? And then what are the studies that show that the gut does anything to do with anxiety? And then the solutions. What do you do about it, right? How can we do some stuff? To me, it's really if you can get less medicine, right? Less medicine. I'm a regular medicine doctor, and I don't want you to stop your medication, but I want to see, hey, what can you do that's natural with your diet, with your lifestyle that can help with this? So let's jump right into it. Okay. Thank you again for joining me. I know you got lots of stuff to do today. It's beautiful where I'm at, and maybe it's beautiful where you're at, but this information can be critical. And if you can give it to others, not only for yourself, but for your family and friends. So anxiety, first of all, not all anxiety is abnormal. Really important to know that anxiety can be a normal emotion. It's a way for your brain to do what? To react to stress and alert you, right? Alert you of some danger. And I always tease my kids. I said, back, when we were cave people, right? What happened? We actually were trying to have dinner, right, and not be dinner. So the anxiety and stress, it really helped us. It helped us to do what? It helped us to get away from our prey. But when your anxiety is there, when there's not a threat, right? I mean, listen, if a dinosaur is chasing me, I think the last Jurassic Park series is coming out. I'll watch it, and it's going to be great. But listen, if a dinosaur is attacking me, I would be stressed. I would have anxiety. But if there's no dinosaur, there's no threat, and you feel anxiety, that's when it can become abnormal. And that's the critical thing to understand, that it's not always that all anxiety is abnormal. It's the fact that you have to have an abnormal reaction, right? Meaning that apprehension about what's to come is really not warranted, meaning that you're not getting a threat. Everyone feels anxious, including me, right? If I remember, I was doing a talk, probably one of the biggest audiences I've ever had. It was like, I think 20,000 people, and I had no anxiety. I think that's normal. I think that helped me. But when you have anxiety and it affects your life, or you don't want to go somewhere, or you don't want to do things that you enjoy, right? And you worry about what could happen, all the bad things, or you let it consume you, and it can even worsen some disease states, right? You don't want to go to school because you're afraid of something there, or you're afraid of something that's going to happen. You don't want to go to your job, or your job performance suffers. That's anxiety. And so anxiety disorders are really critical to understand that these are real problems. These are not problems that, right, are in your head only, and that it's not real. Lots of people who don't have family members who have anxiety, or they don't have anxiety themselves, don't always understand that anxiety is a real thing, and it can be as crippling, right, as any quote unquote physical disease that you have. And get this, to me, I was surprised. Studies have shown that as many as 1/3 of people will be affected by anxiety symptoms during their entire life. That's a big number to me, right? 1 out of 3 people. So it's not a small problem. And if we can give you some solutions, right, to be able to help you, I think that's ball game. So what about some lists of symptoms and signs for anxiety? Feeling nervous, having a sense of impending danger, right? Panic or doom, heart rates increase, breathing rapidly. All of us have been there at some point when we had these symptoms. Sweating, trembling, feeling tired, right? There are some of my patients who have anxiety that they feel like they're tired, they're fatigued. All these tests are being done, right? One after another, but yet they say, I'm just tired, I can't do anything, I can't even get out of bed. So it's really important to know some of these symptoms. Having difficulty controlling your symptoms of being worried and experiencing in my specialty, right? GI upset. It's one of the most common places where people have those symptoms. So, getting right to it, anxiety in the gut. What does the gut have to do with anxiety, right? Remember, we talked about the brain and the gut. So, I'm talking about today the brain and the gut. Your gut has this thing called the microbiome, trillions of bugs that live in your gut, right? It's unique to you and really important for your health. Those trillion bugs can make up a lot of different changes. And I always tell my kids, right, that your thoughts may not be your own, that what you feel is a chemical reaction. The same way, if you get the wrong environment in your gut, it can affect your brain. So those trillions of bugs in your intestinal system, very unique to you and super important for your health. And researchers have actually identified a connection between the gut and the brain. Remember, the longest nerve, we talked about this. If you've seen me, I'm on Tuesdays, 5:30 Eastern, on our lives, and we've talked about this, that the longest nerve, right, the vagus nerve, connects you. In addition, the brain, the gut's called the second brain, and it has neurotransmitters, things that signal stuff that goes to your brain, right? So it's the brain can connect to your gut, and your gut can connect to the brain. Two-way streaks. So what happens in your brain can affect your gut, and vice versa. The gut brain connection can really show anxiety, how it's linked between some of the issues that you have in your intestinal tract, your GI symptoms, and having anxiety. And I'll tell you that the microbes in your gut, right, the trillions of bugs in there are like little almost mood modulators, right? They can elevate your mood, or if you have too much of a bad thing, it can also make your moods go down. So they're happy chemicals such as serotonin, and that's important to know. Serotonin is a neurotransmitter, is a chemical that can be produced in your gut. Imagine that. And if you have less of that, guess what happens, right? Your mood changes. So your thoughts always are not your own. People say, well, that's just who I am, right? That's my personality. But you can change your personality, and that's what I'm saying. It doesn't mean that you always have to be bound and gagged by what you think. You have to, you can change the way you are behaving. So that's very important. Imbalances in the microbiome, we call it dysbiosis. Remember, dysbiosis. Dysbiosis can really change how your gut is and increase inflammation. And we've talked about before, and I'll put this link on the Superfoods Cookbook. You really can give you a great set of foods that can change your microbiome. So very, very good there. But if you have dysbiosis, it can contribute to symptoms of anxiety. Changes to your microbiome can influence the production of chemical messengers that really go and affect the way you think, affect your reaction to things, and make you more anxious, right? So you can change if you're anxious or not, right? By doing what? By really changing some of the gut and how healthy your gut is. Does that make sense so far? Hopefully it makes sense that this is kind of happening, and how your gut could be really modulating you. Thank you again for joining us today. I appreciate it. Again, let us know where you're joining us from. Any questions, we'll be trying to answer them. But I want to get this information out to you. It's pretty important. And again, I'd love to encourage all of you to share this with your followers. I'd love to be able to help them. So a review, I want to talk about studies about this, about anxiety and gut health. a review of studies published in the journal General Psychiatry, good journal, suggests a potentially useful link between gut bacteria and mental disorders. Very, very important. 21 studies looking over 1,500 patients, right? They showed that over more than half the studies, that it was positive to treat anxiety symptoms by regulating the intestinal bacteria. To me, it's amazing. You change your gut microbiome and you can positively change anxiety. Again, this is independent of taking medicines and drugs that could have potential side effects, may not be covered by insurance. These are ways that you can really change your life, right? To me, what side effects are there to eating better, eating whole foods to be able to change your microbiome, having prebiotics, fermented foods, great stuff that you would normally eat, but then bolsters your mind. So to me, it's very important. I tell my kids when they're having a test, I want you to have these types of foods, right? Whole foods. You want to have complex carbohydrates and protein to be able to really change the way you perform, change your mood, change the way you are focused. So this is the same thing we're talking about. So one of the things that they talked about are probiotics, right? Full of good bacteria. And what they found was bifidobacterium. Remember we talked about that. Bifidobacterium, lactobacillus, and lactococcus really helpful for symptoms of anxiety. So if you populate your gut with those kinds of good bugs, can really change the entire paradigm, change the balance in your favor, so you can actually have a great chance of being able to fight this, fight anxiety. For some people, it's a uphill battle, right? Non-probiotic intervention you can also do, right? You don't have to give just probiotic, but you can have foods that enhances your probiotics, right? So fermented foods, great source of having good bugs. And we talk about if you like yogurt, if you like kimchi, if you like sauerkraut, all these foods that so many of us around the world are really eating already. So again, 21 studies, 1,500 patients talking about how the gut and gut health can be related to anxiety and how you can make a huge impact, right? In this world where people are trying to say, hey, how can I be more natural? How can I avoid taking more and more drugs, right? Some of the biggest drugs in this planet, and I talked to so many of my colleagues who are physicians. Oh, antidepressants, anti-anxiety drugs. But here's a shift. Here's a doctor who's telling you, don't stop taking those if it's helping you, but bolster them by changing your gut. When you change your gut, you change the paradigm, and that to me is incredible, because problems of the mind, right? Things like anxiety and mental health disorders are crippling our nation. To me, suicide's an epidemic. So it's really, really important. So researchers found, again, non-probiotic intervention, meaning food, were sometimes even more effective than probiotic interventions. Why? Because food is what you have normally. You eat that every day. And so you don't have to sit there and go buy something or have a regimen. It's just part of your life. Also, a part of the reason why probiotic supplements might be less effective for some people is because the types of bacteria they may contain. So look at the label and see if you have bifidobacterium, if you have lactobacillus, if you have lactococcus. Really important to find out what you're taking, whether it's probiotics or any other pill or your food. You got to read the label so you know exactly what's going on. Again, thank you for joining us. If you're joining us now, we're talking about anxiety and how it affects your gut. Really important topic. Now, what about what food? What good food is there for the gut, right? So one way, as I told you, to improve your health is to have fermented foods, right? Live yogurt, sauerkraut, aged cheese, kimchi, if you like Korean, miso, fermented soy products. Every culture has these fermented products that you can really have. And I'll tell you, the microbes inside your gut, the trillions of bugs, can be like mood elevators. Why? Because they produce things like serotonin, mood boosters that can help you, right? And then have prebiotics, which are the food for the probiotics. So having a high fiber diet, very critical, because they can increase the good bugs quicker. If you have trillions of bugs, right, and you only put a few billion in there, it takes a while. But if you put prebiotics, that's the food for the probiotics, and then can enhance how quickly they get in your system. So very important, right? Serotonin, as we mentioned, one of the products, right? And remember that you could also eat eat your way to increase serotonin. So foods that contain tryptophan. Now you want to go crazy. You don't want to sit there and just overdose on these, but foods that may help you increase serotonin levels: eggs, cheese, you can have pineapples, tofu, salmon. Our kids love salmon. Nuts and seeds. It's one of my go-to snacks are nuts and seeds. And and I'll tell you, the boys in Cali love turkey. So if you can get turkey that's well sourced and you know and trust the brand, that'll be an excellent way to be able to get a good source of tryptophan containing foods. Another way, to me, also, that we're talking about the gut, right? But the gut is also related to using techniques like meditation. We talk about the 5 steps to becoming your own health hero, which means really solving problems yourself. One of them is meditation. And to me, I've developed a meditation guide called Calming the Chaos, because there's so much that happens every day. And I'd like you to be able to understand that when you have anxiety, deep breathing helps you. It also helps your gut. We know that meditation, mindfulness, deep breathing techniques that really alter your anxiety can also alter your gut. I created this tool for you. It's called Calming the Chaos. We'll put the link on for you so you can try that. It's really a guide to be able to try guided meditation and to be able to understand the benefits. And the benefits are immediate. I remember we did an experiment, so to speak, with the police department, our local police department in Detroit, and we saw how meditation really changed within a short period of time, within minutes, anxiety decreased, and over time, even parameters like blood pressure decreased. So I'd love for you guys to check out this my Calming the Chaos guide. I think it will really help you. And again, if you're suffering from anxiety, remember that this is not something that is something that you cannot defeat. There are clearly techniques, obviously the gut, but others that can really help you and really help you get over the hump, because there's not only medicines, but there are techniques that you can use to be able to cope with your anxiety. And then all of the information we gave you today regarding your gut and the microbiome and the techniques you can help to improve your gut health. When the anxiety is taking over, when you feel like you're out of control, don't forget to get expert help. It's really important to talk to your healthcare professional, say, you know what, I can't cope with this anymore. It's really important for me to get help. The anxiety can be crippling. It can devastate your life, and sometimes it can take your life. So really take it seriously every single day. If you have an issue, then remember to be able to get the help that you need. Again, in review, we talk about the gut microbiome, clearly a link between the gut microbiome and the gut, and also anxiety. Multiple studies we talked about with thousands of patients showing that if you can change the gut microbiome, you may be able to impact your symptoms of anxiety. And we talked about, what can you do, right? Probiotics containing bifidobacterium, lactobacillus, lactococcus also can really change the entire paradigm. And don't forget high fiber in your diet. So really important. And again, we created a Calming the Chaos guide for you. Please make sure you check that out. Again, I'll say hi to some folks that have joined us. Holly Rahman, thank you for joining us again. I'm doing very well. Laura Probert, thank you so much. Young Mufasa, thank you so much for joining us. I appreciate that you said it's a nice topic. And let us know why. Why do you feel it's a nice topic? Sumik Sen, my father's a kidney patient, he says, and frequently gets urinary infection. Please send us a private message. Tell us what's going on with your father. We can absolutely help. Brandy Harris from Oklahoma, thank you. Hannah Miranda from the West Side, thank you so much for joining us. And then Christine Sutherland from Port St. Lucie, she's with us every week. Thank you so much for joining us. And then Atanga Virginie from Cameroon, awesome. Clancy Bev Decker from South Jersey, thank you for joining us. And Kay says, I love this topic. I have terrible anxiety and focus, and my diet has helped so much. Thank you. That's really good to hear, Kay, that your diet has helped, because for so many people, they don't think of food as medicine, and food is such a huge part of healing, such a huge part of how you can control your life, whether it's anxiety or other disorders. It's really critical. And now we're showing you the link. Food can change your microbiome in your gut, can change the paradigm, can change the entire equation. So very, very important. So thanks for that comment. Michelle Tool says, what can we do, right? What can we do, she said, to decrease inflammation? The comment just went away. There you go. To prevent inflammation. To me, Michelle, I talk about the 5 steps, right? Living a purposeful life. Obviously, your diet and what you eat, your food plan is critical. You want to also make sure that you move with purpose. There's spirituality and also community. I think that helps you to really, really be able to decrease some of the inflammatory factors that can affect you. Now, I mean, for our purposes today, diet is a critical factor, and having whole foods that can help your gut microbiome is critical. But great question. Oren Gutman says, "Can thank you for joining us, Oren. Can probiotics help with anxiety, and is there a specific kind that's best?" And we talked about that. If you want to get something with lactobacillus, bifidobacterium, or lactococcus, look at the bottle and make sure that's where you find that. So anxiety can really be devastating, and people are on a plethora, tons of drugs, and it still doesn't seem to help them. This is one way you can add to it. We're not saying throw away all your drugs and just go crazy. I mean, that just, relinquish everything and not listen to your doctors, but rather you want to be able to make it additive, right? You want to make your food help your medicine. And Tammy says, like by eating what? And we talked about some of the foods. I think having whole foods with high fiber. We talked about having tryptophan containing foods. If you love salmon, right, that's great. If you love eggs and some cheese and pineapples, again, you don't want to overdo it and just go nuts and take 15 pounds of pineapples, of course, in moderation. But if you mix it up, nuts, seeds, turkey, all those are tryptophan containing foods that can really help your serotonin. So good question though. And then let's take a look. Sri Divya Nalam. How do you suggest this more sensitive people like kids? We're dying every day with each probiotic, prebiotic supplements in the market. I'm not sure what you mean. So I think that you have to do your homework, right? You have to look and see what kinds of pre and probiotics there are. We did a live talking about how you can determine what type of pre and probiotic are good for you. Please, if you look up on our lives, look up my name, Partha Nandi, or send us a message. We'll give you the live. We talked about how to pick pre and probiotics. We're on every Tuesday at 5:30, and it really will help you to find out what you can do to really choose the right pre and probiotics. And Callie says the kids are watching from the kitchen counter while cooking and doing math homework. Awesome. And last math test tomorrow before the summer. That's right. We love those math tests. Math is my favorite subject in school, so I have a soft spot for math. Not everybody does, of course. And then Laura says, how often should someone meditate if you can have anxiety? As often as you can. I say if you can do 15 minutes a day or even 5 minutes a day, that will be helpful, right? So it's better than what people do now, which is nothing. People don't even take the time to breathe, don't even take the time to relax. And I listened to a TED Talk which talked about, when you daydream and you actually concentrate and you breathe, your mind actually is far more effective. Because every time you try to do 15 things at one time, your mind has to stop and start and stop and start. So meditation helps you focus, helps you to be balanced. So as much as you can. Gloria Davis, watching from Alta, California. Thank you. Thank you, Gloria, for appreciate you joining us. And please share this with your friends and your followers. I'd love for them to know what's going on. Let's see. Sri Divya Nalam says, every day I'm being an organic diet, but still having dysbiosis. How do you approach 46% to Bacteroides ratio imbalance? Will just lactobacillus bifidobacterium help? No, I don't think so. Please message us. We'll give you some specific examples. But what you want to do is have a whole diet, right? That has lots of fiber, pre and probiotics. Try to be able to find out how you can get the lactobacillus and bifidobacterium. And if you're taking a supplement, make sure that they have those. But perhaps, maybe we can talk a little bit more offline about specifically, what disease states that you're trying to prevent. And Jackie Susura says, what are your views on cannabis? I believe it's the best option. Work daily with so many clients using cannabis and getting amazing results. Would love to have some views on this. I'm a fan for CBD. I think there are CBD receptors all over your body, and if it's a pure form of it, I just think that using THC um, in patients with anxiety, I think there are better options, and I think utilizing natural techniques such as working through your gut health may be really helpful, right? May be helpful, but I think that if you talk about cannabis, if I look at the CBD component, happy to do it if it's in this pure form. There are many CBD receptors. We know the gut has CBD receptors that can help your gut health, right? So you want to be able to be careful and know your sources, understand where it's coming from, and that you're not adding additives that you don't want. So very, very important. Callie says, we need your help. I'll be right there. I'm almost done. It's funny. And Divya Nalam says, we need help on AST for a 4-year-old. Please message us and let us know where you're joining us from. So thank you, Miss Nalam. Eileen Stack, thank you so much. Hey, again, thanks so much for joining us. I know that you guys have lots of things to do, and I appreciate you taking some time to join us. Again, if you found this beneficial, please share this with your followers. I'd love to be able to get this all around the planet and talk about just to conceptually, hey, you know what, the gut and anxiety may be related. I think another technique, as many tools as we can have to be able to fight anxiety, fight and improve mental health would be so welcome. So again, thank you for joining us. Remember, make healthy living a part of every day. Namaste to you all. Enjoy the rest of your day wherever you are. Thank you. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.